Hello. Yes. So excited to be here. Let's get you on Instagram as well. We're talking about the risks of anesthesia today, which, oh,
I'm
checking
in.
my volume.
I'm in,
Yay!
Isabel.
Okay.
Yay!
Hey, everybody. Thank you so much for joining us because this is such a really, really important topic. There was a study that recently came out which prompted today's video, but I know Isabel and I both have stories and like a whole bunch of other things to add. Oh, thank you. So Isabel, I don't want to be the only one talking.
Hi, everybody. Hi. If I sound a little not so great, it's because I'm still fighting off whatever it is that I got last week. And my kid is here, so you might see a 6-year-old walk in, and I might make a really angry face, and then hopefully that'll be the end of that. I have a fun story actually we can start off with today.
Okay.
I promise that it's relevant to the topic at hand. I promise. But I actually went to a breathing exercise thing yesterday with some friends here locally.
Okay.
It was such a beautiful experience. It is a breathing technique. I'm a 200-hour yoga instructor, so I've done breathing exercises. I've done Vipassana kind of stuff, not a whole Vipassana retreat or anything like that, but I've tried stuff, but this was completely different from anything I've done before. This was actually based on an indigenous practice where they mimic the ability of mammals, specifically, to kind of like shake off trauma. It's inspired by a tribe that used to kind of follow around like deer. They used to think that deer were kind of like wise, and so they saw a deer. The story goes that they saw a deer who was attacked by a wild, like a big cat, and they thought the deer kind of got away. They thought the deer went off to die. And what they found was the deer was breathing. It was doing this breathing, this rhythmic breathing, where they and eventually it kind of like went into a trance, and then it kind of shook off the experience and moved on with its life. So this indigenous tribe, and I'm sorry I don't have any other details than that because that was all I was told, kind of started doing that as a breathing practice, to shake off stress, shake off trauma. So we did that yesterday, and there was 5 friends and the leader, I guess you could, like, the instructor, but like really it was like the guide, and she was so great. And at the end of it, we did the breathing session 3 times, and you go into like a trance through the breathing. And the third time, I cried, I laughed, like I was like, it was like, one of those mystical experiences, I guess. And at the third one, I actually saw my pets, so it was really nice because I saw my pets in, like, they're still very present in my life and all the things they taught me, so that was really cool. But at the end, we all had like a little bit of a snack, and it turns out the guide was a veterinary anesthetist for 17 years. So I was like, this is so crazy that tomorrow we're going to be talking about anesthesia and pets, and she had a lot to say. She had a lot to say. She actually left the industry because she felt like she was maybe too cautious and too careful, and she felt like she was constantly getting pushback about the standards that she wanted to operate under and the standards that the veterinary clinics where she worked were kind of pushing. So I thought it was a perfect kind of social interaction to prepare for this conversation, because that is something that I thought about so much, especially with the veterinary shortage, and how when you start cramming care into your days, you can really open yourself up to mistakes. And like, that's my biggest thing, is because we already know that in in humans, the number one cause of death is medical error.
Malpractice, medical error. It's funny that you say that. You met this veterinarian who is
Well,
Um,
she's a veterinary
yeah.
anesthesiologist tech. So she was
Okay.
a vet tech that was her specialty was anesthesia. So
Yeah, she's smart.
she worked in North Carolina. She worked with veterinarians alongside them. I was interested to know how many practices even have a vet tech that specializes in anesthesia. I don't think it's common. Yeah. And so I was really I didn't even know that that was a thing. She worked before she left the industry. She worked in specialty practices where they did do a lot more complex cases. So it was just really cool to see that 17 years ago, I think she was in it 17 years, and then I think like maybe 10 years ago she got out of it. And it was really interesting to see that the concerns she had then, I think, even are multiplied now
Oh my
in many ways.
gosh. Yes. I have two stories. I don't know if you want to talk about this study first or
Yeah, let's talk
um
about the study. But the study was obviously these studies are small. You know, the cases that they cover are limited. So
yes.
this was a study in a 2023 study done at the Aristotle University of Thessaloniki in Greece. It analyzed anesthesia deaths in dogs and cats and possible causes. They looked at 1,187 dogs and 250 cats from January of 2018 to December, sorry, of 2019. So that's 2 years basically.
Yeah, pretty much.
And the issues in the heart and lungs were the ones that caused the most deaths in animals under anesthesia. So that to me is a really big takeaway. If you have a pet with any kind of pre-existing heart condition, pre-existing lung conditions, which are less common but still there,
Hmm.
that should definitely be kind of like a red flag. And the deaths occurred during maintenance anesthesia, so it's likely due to prolonged duration. So the
Yeah.
longer the procedure takes, the age was not a main risk factor. It said the health and breed were more factors than age, which is so funny because for me, it's always like, oh, after 13, I don't want to put them under. But
Yeah.
that's not necessarily
Yeah.
based on
Well,
on the results of this study.
what's interesting is that like I didn't read all 15 pages, but I did scan all 15 pages.
Yeah,
And further in, like around page, I don't remember if it was like 9, 10, 11, somewhere like that, they did say that they felt that age was a factor, that it was more in senior animals. But they were also talking about a lot of prior studies. So they were comparing the
right.
study to a lot of prior studies. Um, and I do, well, I'll say that in just a minute. One thing I did want to point out, I highlighted for myself, it says in an earlier study reported that dogs receiving opioids, oh, I can't talk, y'all. Okay. An earlier study reported that dogs receiving opioids and NSAIDs had lower mortality risk compared to patients that did not receive any analgesic. In other words, the statistical significance of these findings should be interpreted with caution because undefined confounding factors might have affected our results. So they're like they went through so many different things with so many different studies that had happened before this, and they're pretty much saying that like the data is kind of all over the place. And that's what I was thinking too as I was reading this. I'm like, how are we like not all things are equal, right? When we're comparing these animals and what they're going through in anesthesia. So, how are we really being able to say what's actually going on and what are and so that's what they're saying. There are so many confounding variables that it's really hard to pinpoint any one thing.
Yeah, for sure. Well, I just want to shout out to Dianico. I
Yeah.
hope I pronounced that right. In the UK, it is very late. We understand. Take some rest. Listen to your body. Have fun.
Yeah.
And we will see you next time if you can stay up late for us next week. So don't worry. You can catch this on either one of our
Socials.
timelines or
Yeah,
socials, whatever.
absolutely.
Okay, so this is what's interesting to me is like when it comes to anesthesia, I feel like we're in the dark. I mean, this is one study. There are many.
Yeah.
They kind of sort of already tell us what we already know, right?
Yeah.
Like if your dog has heart issues, chances are the risk is higher.
Yeah.
If there's a ventilator used,
Hmm.
the risk is higher.
Yeah, if they're
The risk of
innovative.
heart failure is higher. But we already know this because we also know this about humans, right?
Yes.
So like I take care of my aging grandmother. She just turned 87, 88, I can't remember now. We just celebrated her birthday. And the numbers run together, as she says. But every time we speak about anything with her care, is anesthesia will have long term effects on her cognitive ability. It will potentially, at this age, you potentially don't wake up just
Yeah.
because either medical error or just your body is too taxed.
That's
So we
what they
know,
said happened to Joan Rivers, right?
yeah.
Yeah.
Well, I mean, one of the things that has traumatized me forever is Kanye's mom.
Oh.
Kanye's mom was, I believe, I may be wrong, but she was in her 50s. And she went in for plastic surgery and never woke up. And they
Mm-hmm.
blamed anesthesia, medical error, pre-existing condition that just didn't jive with the anesthesia. Do we know? Maybe, maybe not. There was a lot of rumors.
Yeah.
I've never really followed up to see what the coroner said. But obviously, that's really scary when you think, like, obviously, for elective surgery for humans, I'm like, please, I don't think I would ever do it personally. But there's a huge risk. And then with our pets, none of us are really doing elective surgeries with our pets.
No.
Like, the only
I hope
surgery
not.
I mean, I did do the booty lift on
Well,
socks,
that was still
and it was
medically necessary.
elective because we could have managed it otherwise. But it's always like the risk reward, right? For her, the reward, and I don't regret it at all. We actually went through with an episoplasty, which is like a booty lift for a dog, for a female dog. The skin that covered her private parts, I call it her little paintbrush. We lifted the booty. They literally make like a little incision that looks, a huge incision actually, that looks like a horseshoe, and they lift the skin so that the little paintbrush comes out in all of its glory, and it no longer is trapping bacteria and stuff. She was so miserable all the time. She was on antibiotics all the time. No matter what we did, no matter what supplementation we used, there was a physical anomaly that caused this discomfort and this illness. So we did it, but it was elective in the sense that we could have just continued with the antibiotics and the discomfort, and she would have just lived with it. But those are the cases where I feel like it's the most, when you really have to weigh, just like dentals, obviously you have to have your pet under in order to get a dental. Is it elective? I guess. But is it ensuring your pet's comfort and longevity and overall health? Yes, as well, just like the episoplasty did for socks. So those are when it comes down to, like, my dog is 13, Kira, and honestly, she's healthy enough that I have no reservations about her going under in October for her next dental, because she gets one annually, right now. But like between now and October, things could change, and then I could change my mind about whether or not it's worth it, like whether or not the reward is there, or if it's just kind of precipitating an outcome that I would like to postpone, right? Like I don't want her
Right.
going to the bridge anytime soon. So if I were to know that there's something going on with her, we wouldn't want her under. The
Yeah.
cool thing is that we all do, I mean, we should be all doing, and if your veterinarian doesn't do this, it's a huge red flag. We're doing blood work before. So for pre-existing concerns, you should know before your pet goes under if there's some risk factor based on their blood work. They do it within 2 weeks usually. The closer, the better. I think that if any veterinarian is not doing that, because I have had that happen where it was like, no, we don't need blood work, and I was like, no, we do.
Yeah.
If you're somewhere where their veterinarian is kind of like, maybe because they get a lot of pushback about cost, if you can afford blood work, always do blood work. Always do blood work. And listen to that blood work, right? Like, why would you use it if you aren't going to listen to the results? So if there's something there that your veterinarian says, it could go either way, take a moment, think about it, sleep on it, do some research, contact some experts, and then, make your decision. But if it's clear, then you should be clear, but that does not remove medical error.
Oh yeah,
And that
absolutely.
is where I think that the most issues happen.
And that's actually my story. um, so I'm really glad that even though it seems like we didn't get a whole lot of information out of this particular study, like I'm still glad they're doing it
Oh, for
because
sure.
all of these studies, combine them all, they all add up and they all give our veterinarians insight into different things. And hopefully, like every time a new study comes out, obviously not every veterinarian is reading every study that is coming out, but they are reading some studies some of the time, and
And they may go over
that,
things like this at
yeah,
like conferences and stuff,
yeah,
so that hopefully does reach them at some point.
right. Because the reality is, so I was at the vet on this past Thursday with my cat Riley. So I have a veterinarian who comes into my home. She does home visits and does all of my pets. We annually, all of them, and then every 6 months for a couple of them. So she comes in. It's just so much easier for me
Oh my gosh,
because
yeah.
I've got five pets,
Yeah.
right? So I just get it all done at one time. She comes in, she draws blood on everybody, does exams on everybody, the whole, the
Shebang.
works.
Yes.
And when I have to take one of my pets in for a prophylaxis, so um, Dr. Katie Kangas was on my podcast February for Dental Health Month, and we talked all about dental procedures. And she is a very professional veterinarian, so she uses words like prophylaxis.
Yeah.
So I'm trying to use professional words here. Anyway, so a full dental cleaning under anesthesia, and so when I have to take one of my pets in for that, because the veterinarian that is doing the procedure has not seen my pet, I have to go and take them in to have that exam done prior to booking the procedure. So
Understood.
that's what I was doing. I took Riley in, and I am already like kind of heightened to anesthesia with my animals because of Riley. And I will tell you that story in just a minute. But what happened during this exam, I told the veterinarian, who happened to have not seen Riley before because she's only been at this clinic for maybe the past 6 or 8 months, and he
Okay.
hasn't needed to go in. So I told her the story of what happened to him and why I'm so concerned about anesthesia. So we had a really good conversation, and she was like, "Oh my God, me too." So, like, she's the only veterinarian at this clinic that does dental procedures, which is a good thing because not all veterinarians are good at everything, right? That's kind of one of
Right.
the themes of a lot of the things we talk about is that we rely on our veterinarians for far too much. They are not specialized in everything under the sun for
Right.
our animals. So there are, a general practice vet likely will over time get good at cleaning teeth because they pretty much are going to
Yeah.
have to. But that doesn't mean that they're getting everything they need straight out of school to be excellent at this
Right.
out of the box, right? Um, and there certainly are procedures that you do need a specialist, some sort of special surgeon who, they know these really random, rare surgeries that need
Yeah.
to be done. Um, so she was like, I wish people understood what you understand, that even though it is common for us to put our animals under anesthesia, we should not be treating it like it is so, like we treat it like it's just a normal routine. Here you go, here's my animal kind of thing. And there are so many risks involved. And she was like, I just told them, like she was like, I just had them buy all new equipment because I was not comfortable with the equipment that they had, and I wasn't going to do it anymore unless they upgraded the equipment, and they did.
That's
So like,
exactly what this
yeah,
vet tech told me
yeah,
about. Yeah, she had to ask for specific medications. She had to ask for specific equipment.
mm-hmm.
Valves that were kind of like
Monitoring equipment and yeah, all kinds of stuff.
valves that made sure that there were like kind of like safeguards to error, right? To human error. They
Yeah.
didn't have those things. And so she was, advocating for the pets she was taking care of, but it wasn't easy. And
Mm-mm.
it's not something that happens at every practice. Like this,
Yeah.
your veterinarian, they did that for her, but that's
Hmm.
not always the case.
No, right. So it's important to like have this conversation with your veterinarian and know some of the like key questions to ask. So my key questions to ask are one, so and a lot of people don't know this either. And I don't know the exact words for like what these are labeled, but I always get for years, I have always had the option of standard veterinary like anesthesia and human grade anesthesia. And the way it was explained to me is that if I opt and pay the extra fee for the human grade anesthesia, that it's easier on their system and that they come out of it quicker and easier. So I always opt for that
Okay.
because I mean, that's what they're telling me. It's easier on their system, right? And they come out of it easier. And I'm just like, anything I can do to make this
Right.
easier on them, right? So that's one thing. And then I want to know that um, the veterinarian is not performing the surgery alone. So there is somebody there watching my animal, assisting, whatever. And then I want to know that they are giving IV fluids before, during, and after the treatment. So these sound like really, really simple things, but how often are we asking them? We're not asking them. And if we're
No.
not asking them, then we have no idea what is going on. And a lot of veterinary practices are not doing one or more of these things.
Right.
And I know this because of what happened to Riley in 2016. I did not know to ask any of these questions. But honestly, even if I did know to ask any of these questions, it was such a rush thing that happened. So in 2015, late 2015, he started getting urinary blockages. So 2 or 3 times they were able to clear it up, like remove the blockage. He's good. It'll probably come back. Of course, the veterinarians, and one time, even at the emergency vet, I had 2 vet techs team up on me and tell me that if I didn't feed that prescription kibble, that he was going to die. So that's another story. But
Yeah,
anyway,
we talked about that at after yesterday's breathing exercise too. The
yeah.
veterinary diets.
Um, so he blocked again. And it was kind of like this rush to, okay, are we going to continue this cycle within days and weeks, thousands and thousands of dollars, and then it's just happening constantly to clear out this blockage? Or, because I didn't know anything else at the time, get what's called a perennial urethrostomy. So they basically remove the penis and kind of widen the urethra so that there's whatever like stones are being formed are easier to pass through. They're not, nothing is blocking anymore.
Mm-hmm. Mm-hmm.
So I said, yes, let's get this procedure done. I don't want to keep going through this. I don't want him to keep going through this. He is uncomfortable. And the issue was nobody at any of the emergency clinics at my regular vet could perform the surgery. So they had to find my vet, my primary care vet, found a traveling surgeon in the area who did these surgeries, and she couldn't do it for like a day or two. Like she couldn't get there and do it.
Right.
So he was blocked. He was in the hospital, blocked. He couldn't pee. It was horrible. And it was just this like really, really intense situation. And I didn't know or think to ask any questions other than fix this,
Right.
right? Please,
Right.
like, I don't want him to die. So she gets him under, performs the surgery, and it's like, it's got to be like 4:30 in the afternoon. And I've already called my vet's office, I don't know how many times, checking in, and I'm like, I've got to call again. Like, they're
Mm-hmm.
about to close in 30 minutes. I haven't heard anything. What's going on? I finally get my vet on the phone, not a vet tech, my vet. And she's like, Well, something happened. So, what happened was that this surgeon was performing the surgery alone. Nobody was watching my cat while she was performing the surgery. And he's a heavy boy. He's not a 10-pound cat. He's heavy. And for this particular surgery, he has to be on his back. Well, all that extra weight pushing on his lungs and his diaphragm, he stopped breathing. And nobody knew it because nobody was watching until she looked up,
She
and
came
I
out.
guess there were no monitors. She looked up because he was like purple, right? And so then everybody rushed in, my vet rushed in, and the surgeon was so freaked out that my vet had to jump in together. They brought him back, like CPR, they brought him back. And then the surgeon was so freaked out that she didn't want to finish the surgery. And my vet had to talk her into finishing the surgery. She was like, "What is the point of everything we just did if you don't finish this surgery? Because he's going to die anyway if you don't finish the surgery." So she talked the surgeon into finishing the surgery. He had lost oxygen to his brain long enough that he was completely out of, like, he had no response. His eyes were open, he was breathing, but he was not responding to anything. They sent him home with me that night, which was the second biggest mistake they made. He should have been under intensive care and he was not. So I spent the night on the floor with him. He was just constantly seizing over and over because of the pressure on his brain. So I got him, I like texting with the surgeon throughout the night. We made a plan as soon as the closest emergency clinic opened in the morning, she was going to meet me there. So that's what we did. And he wound up in ICU for a little over 24 hours. They had to put him on medication to reduce the swelling in his brain. I brought him home. The seizures stopped, but he lost his eyesight and he couldn't walk. So he was basically like rolling himself around when he had to pee. He like knew instinctively he wanted to get to the litter box, but he couldn't because he couldn't walk. And then um, about a month later, I take him in. I mean, this was a horrible month. I take him into my vet, and my vet is like, this quality of life isn't good. You may want to consider putting him down. Blah blah blah. I think he heard that. I was working with him. Like I would hold him up and move his legs and trying to like rehab him. So within about a week, he started walking again, and it was a slow, like really really slow progression. He's totally fine now. He can't see. He lost his eyesight, but it was traumatizing. And so I told the vet in the office, and she was like, "This is exactly why I am so strict about the protocols I put in place when I put any animal under anesthesia, and I am going to discuss the risk versus benefit in every single surgery I do, because even though, like, okay, yeah, his teeth may not be that great, is anything like I don't see any signs of lesions or resorptive disease, like anything like that. So, like, we really do in some animals, in some instances, like, we have to really weigh it out and just not say, here you go, here's my animal, put him under anesthesia.
Yeah,
It's
for sure.
it's just not that simple of a I don't know. It boggles
Well,
my mind how we've just kind of, it's just mainstream, right? Like, yeah, put them under.
yes, it is akin to when, we are told, "Oh, you have a little cold. It's okay. You can still get the COVID shot." Like, no. The insert literally says like you should not be ill when you take any vaccine.
Mhm.
But because so many people have done it and not had an issue,
Yeah,
right? Then it becomes like it's not an issue.
yeah,
But there could be an issue. It's not everybody's problem. It's because that person or that animal had some kind of right situation. In
Right.
your case, it was that his airway was closed, right? Like
Yeah. Yeah.
basically his airway closed during the surgery. A lighter cat may not have had that issue.
Right.
That surgery may have been fine for that cat, but like we don't take enough precautions. And I say we as a society, obviously
Yeah.
I'm not a medical doctor or a veterinarian, but I think that once you start thinking about it from like, oh, who's on my schedule? Oh, I'm going to do this today. And it's like bang, bang, bang. You forget that you're dealing with an individual that could have some kind of pre-existing condition, something that you don't know about. Because just because the blood work came out normal doesn't mean there's nothing
Yeah.
else going on
Yeah.
that could rear its ugly head during or after the procedure. There's no, I've heard recommendations for teeth cleanings for dogs that are undergoing chemo and stuff. Like, why? Like, why would
Yeah.
you put that strain on the body, right?
Yeah.
Even if you, the veterinarian, have seen that successfully work out, right? Like,
Yeah.
do we need to push the body? Do we always need to push things?
Right.
Can we give the body a minute to get
Yes.
over a cold before we do the vaccine? Can we wait until we have a better understanding of what's going on with my pet before we put them under for a dental?
Hmm.
Because we can delay a dental 6 months. We can't bring them back from the
Right.
dead. So like to me it's so important to like kind of be really strategic and to have a little bit of distrust for the system, right? Because the veterinarian might tell you, or the doctor might tell you, oh, it's fine.
Yeah.
Just like when I had a vaccine reaction when I was given the Tdap and the flu shot at the same time. This was when I was 34 years old. And I was like, oh, I haven't had the Tdap in a while. And they were like, oh, do you want the flu? And I was like, I mean, can I do both? Because for my pets, I'd always done one
Yeah.
at a time. And they were like,
Good.
no, lots of people do both at a time.
So,
And so I did
yeah.
both at a time. And now I would never do both at a time because it killed my immune system. It was too much for my body. I'm very small. So it was like a dose that all those doses they were too much for me as an individual. My husband, who's 200 plus pounds, but 6'2", might have had the exact same dosage and had no issue,
Right.
right? So it's like have that little bit of malice or that kind of distrust that says like, but did everybody who survived this or every pet who did fine, are they my pet? Like, is there
Yeah.
a guarantee that my pet will do as well or that I will do as well? Because there isn't.
Mm.
No doctor, no medical professional is going to give you a guarantee of any sort.
Yeah.
On the contrary,
No.
you're going to sign your life away
Hmm.
that they are not to be held responsible because they can't control certain factors, which is totally legit. But again, it's like having a veterinarian you trust is so important because if my veterinarian says something, I know that I can go back and be like, how about if we did this instead? And I believe her when she responds to that question that she has my pet's best interest in mind. Always. I love her. She always has Jackie, her vet tech, in every surgery. I don't know what kind of anesthesia she uses. I will be asking. She is always so thorough. She is amazing. She's even done an ocular surgery for radar that was going to cost us like $4,000 at one place. She did it beautifully herself because she has so much experience. She's a one vet practice. She has such a great team. She's super strict about everything. So I think that I trusted her to do that. And it saved us, I think it saved us like $3,000. And because I trust her and know her,
Yeah.
but more than the other people, I was like, let's do it. But I've never thought to ask about what kind of anesthesia they use because I didn't even think that. Why? I feel like because of FDA, I would have assumed that vets can only use veterinary grade anesthesia, and obviously doctors can only use
Yeah.
human grade anesthesia. So like I didn't even know that was real life.
Yeah. Well, and some veterinarians probably only do use the better, like human grade. And so why would they even ask you? Like, and it sounds like your vet may be one of those vets if she's that, like,
She's pretty by the book though. So like even though she and I don't agree on everything, I can say, listen, this is my concern, and she can be like, okay, I get it. I get it.
Yeah.
And she can, meet me halfway. And she always tries, which is one of the things I love about her. But at the same time, I recognize that she and I do not have the same priorities and the
Mm-hmm.
same kind of philosophies.
Mm-hmm.
So when she gives me advice, I kind of make sure I run it by myself and my standards. And
Yeah.
I say, that sounds like it's in line with what I want for my pet, or that doesn't, and what other options do I have, right? And I've never had an issue where we did not find a common ground. For my cat, it's a little scarier because I feel like cats are the, redheaded stepchild of the industry, where
Yeah.
like a lot of vets just kind of like, they kind of,
Yeah.
yeah, sure, well, we schedule the cat. In my case, she is very good. She has a cat room and a dog room, so it's good. But
Mm-hmm.
still, like cats, I feel like there's not enough studies done on cats. There's not
No.
enough information for cats.
Mm-hmm.
Cats are like more trial and error than dogs are when it comes to
Mm-hmm.
veterinary medicine. And because my cat is young and has no pre-existing conditions, obviously he's going to be fine. But as they get older, cats hide their illness really, really
Mm-hmm.
well. They really do. And
Yeah.
so that this study showed like 13 dogs, of all of those dogs went into cardiac arrest, and 7 of them died. And the rate of cardiac arrest was higher in dogs with poor health. So
Mm-hmm.
outside of that blood work, we don't know the
Yeah.
health. We
Yeah.
don't know if there's toxin buildup. We don't
Mm-hmm.
know
Yeah.
anything like that.
Very
So it's
true.
really concerning, whereas I feel like even some dogs hide it really well, but cats are, I mean, they're like ninjas, right? Like they don't
Yeah.
want to show any illness whatsoever. So you're going in blind to these appointments, hoping for the best.
Well, even, if we just look at the numbers, in 2 years, there were more than 4 times the number of surgeries on dogs than
Yeah.
cats. And so that to me also, I mean, I just think back, and of course, this was in Greece, this wasn't in the US, but I think to our society here in the US, and we just tend to give more medical attention to our dogs than to our cats. And I think that's probably not as true in the like holistic or the healthy pet space that we kind of live in. But in society as a whole, I do think that is very true. So, yeah, exactly. What are all the confounding variables that are going on with these cats that we are probably not even seeing, not necessarily seeing in our dogs, because dogs are probably getting more and better medical attention throughout their lifetime than our cats
Yes.
are. Um, so that could also be playing a factor in like why their mortality rate was higher.
So really the reality is, if you know your pet is sick, then take pause. Really weigh your options. If you don't know if your pet is sick, that's when it gets hairy, because it's like it comes down to a lot of things for me. If your pet is healthy, you assume it's healthy, but you're having a really hard time getting into your vet because they're so slammed and they're so short
Yeah,
staffed.
yeah.
That to me is also a huge red flag.
Mm-hmm.
Because when people rush, people make mistakes. When people are scattered, when people are short staffed, when like you said, there's nobody else in the room, people make mistakes. So that to me is a huge concern, especially as we look at numbers coming out that say that in like 10 years we're going to be short like what, 30,000 vets in the country,
Yeah, it's
something like
crazy.
that. So like, where do pet parents kind of take their pet if they live somewhere that's like a veterinary desert? They have maybe one clinic to go to an hour
Yeah,
away, and so many people are going to that clinic and they are short staffed. So
yeah,
that just opens up the veterinary community to error. I mean, it's
mm-hmm.
inevitable. It's the same as when I'm here trying to mom and work at the same time. I can't do that well because I'm in two
Yeah,
places at once. And when you're, running from a consult to a surgery to a this to that, there's a lot of risk. There's really a big amount of risk, and we see that in humans too, in hospital systems. It's really
and
scary.
this is error on top of the fact that our veterinarians are doing way too many jobs to begin with. So even if we had an adequate number of veterinarians, the reality is they are, like we were just saying, they are not specialists at everything.
Right.
And I haven't finished it. I was just listening to a video that Dr. Odette Suter did yesterday with Chelsea Kent. First of all, Dr. Suter is like the cutest little
I
thing.
love her
I
so
love her so
much.
much.
She's
And
the poop
Chelsea,
doctor if you don't
she
know
is the
her.
she's
And
the
she wears
poop lady.
it proudly
Yes,
with her poop emoji leggings that she wore to
yes,
Super. So it's
I
like, oh
know.
my God, I love you so much. You're so cute.
I know she's the best. And
Yeah, she is.
Chelsea Kent also. I have not had the pleasure of meeting her yet, but it is on my list of things to do. She's, first of all, an incredible food formulator and herbalist, and I don't know how she wears as many hats as she does. But anyway, they were talking about so many things, but one of them being that our veterinarians have little to no nutrition training, and what they do get is from probably Hills or Purina,
Yes.
maybe Royal Canin. Like that's where they're getting their
Yes.
nutrition information from. And even the standards for the pet food market are based on kibble. Period,
Mm-hmm.
full stop. Like that is the basis for regulation. So there are so many things. I know we rely on our veterinarians for way too much, and we are putting them in a bad situation. Also, they, not all, but a lot of them don't want to give up control over every aspect of your pet's life. So there's that back and forth that we really need to refigure. And I think even with the veterinary shortage that is already happening, is only getting worse.
Yes. It's only going to get
Our
worse.
absolute best plan of attack is more education and more preventive care, and actually raising our pets with health in mind and not convenience. What was she? Oh, so like I think she was giving the example of, like, I don't know, say Total cereal, right? And okay, this cereal is when it has 100% of exactly what your child needs to grow up big and strong and healthy. Would you feed that cereal if you went into your pediatrician's office and your pediatrician said to feed this box of food, this cardboard box of food, to your child every day, all day, for the rest of their foreseeable
No,
future? Would
of
you
course
do
not.
that?
Of
But
course not.
that is what our veterinarians are saying, and we do it. And why the
Yes.
hell is that?
It's a really
Why?
interesting thing because I think that even in being raised in Latin America, we used to make our dog food. There was no dog food like you could buy. And I guarantee you that if I went back, they're all eating kibble now. You know what I mean? Like, because and it's
Yeah,
convenience. It's convenience.
right.
And we used to get like these huge bones from the store. We used to go to the grocery store and be like, go talk to the butcher and be like, can we get
Yeah.
your bones? And we used to make this whole thing with oatmeal and all sorts of stuff in it. My mom used to make it, and these were for guard dogs. These weren't even our pets. But that was the only option at the time, unless you wanted to go somewhere like rural and get like feed for some other
Hmm.
species, and
Yeah.
that's what you had available to you. Um, Reality is, yes, the fewer veterinarians we have, the harder it is to get into the vet, the smarter it is to really bank on preventative care.
Yeah. Absolutely.
Diet being the first one. Because, I
Yeah.
mean, what you are not going to, you can't spend money at the vet if they can't see
Yeah.
you, right?
Right.
Like,
Yeah.
they can't see you.
Hmm.
Like, I mean, there's been, like, I took Van Gogh to the emergency vet and left without paying anything because after 2.5 hours, they were like, we're so sorry, we're not going to be able to see you.
Mm.
And so I wasn't charged a dime. But I
Yeah.
did waste 2.5 hours there, and I still
Yeah.
didn't have a diagnosis for the cat that I needed. Right, that's why I was
Right.
there. And I
Yeah.
and I no hate because there were much more pressing issues at the
Yeah.
time at that vet going on. There were like 4 dog attacks and all these things. So got it. But when we can't take our pets to the
Thank you.
vet because it's so hard to get it in. It's hard to get an appointment. Like, I mean, I'm pretty much having to schedule Kira's dental for October, like in August at the
Yeah.
latest.
Yeah.
At the latest. And
Yeah.
it'll probably be toward, Halloween. So
Hmm.
that is 3 months out. If you have an emergency, you are in a situation where you're going and sitting and waiting to see if they can see you. And if they can't see you, like in a place like El Paso, if you need some kind of diagnostic, you are going at 6 a.m., standing in line at the door, waiting to
Yeah.
hope that they can see you when you walk in, and then still waiting 4 hours because they do take appointments and walk-ins and all these things. And it's insanity. So yeah, like that money that you're not spending at the vet because they can't see you, invest it in your pet's food. Let's
Hmm.
start with just food, improving some kind of aspect of your pet's food. And
Yeah.
then also just knowing that risk is there no matter what. Because I mean, I remember being in Spain this in January, walking my sister's dog when she had her baby, and I think he had just had a procedure. What did he have a procedure for? I can't remember. Was it dental? I think he had dental, but like one of the neighbors saw that he had like his, the
Oh,
little
yeah.
shaved area where the IV
Hmm.
goes in. And he was like, "What happened?" And I was like, "Oh, he just had his teeth cleaned." And he was like, "Oh, where does your sister take him?" And I was like, "Oh, the vet right there." And he was like, "Oh, I stopped going there because they killed two dogs under anesthesia." And
Oh,
so another thing to do is, and you know what, I don't want to say that that vet really did kill,
right.
but
Yeah.
where there's smoke, there's fire. So
Yeah.
like, if you do hear that something is
Uh-huh.
going on at your veterinary clinic where, there was an incident,
Mm.
at least ask about it.
Yeah.
Be honest with your vet and be like, my neighbor told me that like two dogs died under anesthesia here. And I don't know that my sister even followed up because she has a great relationship with the
Mhm.
vet and has always trusted her. So I don't think that my sister even like let that hearsay affect her.
Mhm.
But for me, as the advocate that I am for my pets, I don't care how close we are. And if we're close, even more so, I'm going to be like, hey, I heard this. This is what people are saying. You
Yeah.
should know this. And is there any truth to it?
Right.
Because, like I said, where there's smoke, there's fire. And of course, like, apparently there had been like a change in text and a change in this and like
Mhm.
that, you know what I mean? And you always have to wonder, like, how much is the veterinarian doing? How much is the vet tech doing? How
Right.
much experience does the vet have? If it's a brand new vet, like, there's a
Yeah.
thing, there's a reason why, like, muscle memory is so beneficial. It's because you have, the processes one after the other. And we kind of want to stay in the middle. We don't want to go on autopilot where you're not thinking, right? Because you
Right.
think you know better. And we don't want you fumbling through the valves
Yeah.
either. We want somewhere
Right.
in the middle where you're confident, you know what you're doing, you know how to troubleshoot, you know when
Mhm.
something's going wrong, you have safeguards in place that check human error, all those things. And if you're not talking to your vet about those things, like your 3 questions are fantastic, then you are not like you're not really truly mitigating the risk.
Mhm.
So it really does fall a lot of times on the pet parent to
Yeah.
ask the right questions,
Yeah.
to keep their eyes open. Even if you've been going to a vet clinic, check
Mhm.
their reviews. Check their reviews recently. See if something's going on before you make a decision that you might regret. Because especially now where veterinary clinics are being gobbled up by big corporations, that
Yep.
veterinary clinic that you've trusted for years may not be the same. And even if
Right.
it's the same vet, it may not be the same budget, and it may not be the
Mhm.
same revenue goals, and it may not be the same operation that you're used to. So always
Mhm.
just don't rest on your laurels just because you've been going to the same vet for 10 years. Like,
Yeah.
that to me that is when you say, "Oh no, I wish I had. I shoulda, coulda, woulda," right?
Yeah. Oh, yeah. Because I mean, I remember the vet I had in San Diego. I did at the end. I started getting more and more uncomfortable because we did have a good relationship. So she did tell me a lot of things that she wasn't telling other clients, and she was having her techs do a lot more than I was comfortable with in a lot of situations. And I mean, she was a one vet clinic, and I'm like, I'm paying good money for these services, and there are certain things I expect the vet to do, and there are certain things that I understand that a tech is going to do, right? Like,
Yeah.
yeah. I
Yeah.
mean, the vet should not be doing nail trims. Like, you know what I mean? Like,
Yeah, of
there
course.
are things.
Yes, of course. And it's not an anti-vet
No, no,
situation.
no.
It's just the vet industry is changing so much and they have
Yeah.
a hard time. That's fine. The FedEx man is not going to interrupt me right now, okay, baby? Yeah, of course. We have like 8 minutes left
No,
and he
it's
couldn't
fine.
help himself. He's sick, so impulse control is not his,
Yeah.
forte. But yeah, I think that with things changing right now, it's really a matter of taking personal responsibility for knowing and like not trying to scare anybody and not trying to talk
Yeah.
bad about vets, but like
No.
we can't expect for us to just show up and everybody else to have the answers for us. There is some
Yeah.
part of it that falls on us. Like as a parent, I can tell you that when I make decisions for my children, I don't take everything the pediatrician says as law
Right.
because that is not how I am as a parent.
Yeah.
And I'm not like that as a pet parent either. I do question, I do ask questions, but then I look at like my mom who a doctor says jump and she says how high, right?
Mm-hmm.
Like, that's
Yeah.
because of her in her generation, the doctors there was no internet. So the doctors
Mm-hmm.
were the people you trusted. And
Mm-hmm.
if there was an error or a mistake or it wasn't the best thing, there was no way to troubleshoot it. You didn't know, right? Like you didn't
Right.
have the horror stories that we read online.
Yeah.
You didn't have access to that. So if your friend said, he's been a great doctor, oh, he made a mistake this one time, you say, oh, people can make mistakes. It's okay. Now we have this crazy amount of information where we can't just expect the doctor to have all the answers for us. We can't expect the vet tech to like just, or the office manager to be like, yeah, it's going to be great. Like the office manager is not a vet. So if you're
Yeah.
going to have a question, ask the vet.
Right.
And remember that, you're weighing the short term versus long term. So like to me, long term health and dentals go hand in hand. There's studies that show that, right? So we need to
Mm-hmm.
make sure that dental health is a priority. But dental cleanings are not the only way to prioritize dental health, right?
No.
So there are other things
Yeah.
we can do that don't just put all of the responsibility once a year on that
Mm-hmm.
dental to maintain our pet's teeth.
Yeah.
So maybe if we were more involved in our pet's dental care, we could extend it to every 2 years,
Mm-hmm.
potentially, depending on, like you said, if there's an abscess or if there's infection or if there's decay, some kind of
Mm-hmm.
thing.
Yeah.
But like the surgery, these procedures are not the only option in most cases. So obviously, always consider what is less invasive
Yeah.
and opt for that as long as the result will be similar or just
Yeah.
buy you some time. You know what I mean?
Yeah.
Because
Yeah.
with socks, we delayed that episoplasty as long as we could, and eventually it was like, okay, it's time. Like we've tried everything else and now it's time. And Transgirl 12,
I
thank you
know.
so much for commenting and for joining us. You're scared to do dental cleaning for your cat. This is the thing. Cats need dental so much more than big dogs, for example, because they have
Yeah.
such tiny
They
teeth.
do.
And what they're eating in the most cases, especially if you're feeding kibble, stop feeding kibble if you're feeding kibble to your cat. But that stuff causes so much decay, and they have these tiny
Mm-hmm.
teeth, and there's not a lot of room between the teeth, and they
Yeah.
don't have bones to clean their teeth. So it's like for
Mm-hmm.
cats, the dental, unless you're brushing your teeth, which Ryer Ryer, Ryer Cat is an amazing brand that sells toothbrushes specifically for cats that keep them happy while you're brushing, that don't hurt they have a little nerve on their palate that you can really hurt and really turn them off if you use just any toothbrush. So, be proactive by brushing your cat's teeth. We love Ryer Cat. They're coming out with toothpaste now for cats, which is I'm looking
Oh,
forward to seeing what they come up with.
yay. Yeah.
But yeah, she's a
Yeah.
you're afraid to do the
Good.
surgery and you're afraid of the anesthesia. Anesthesia is really the biggest risk factor because
Mm-hmm.
otherwise the dental, I mean, she's not going to be happy about it, but
Yeah.
she's going to have, a longer, healthier life because,
Mm-hmm.
health really does start in the mouth a lot of the
It
times for our pets.
does. Yeah, you really, I mean, that's why even though I went through that with Riley, he's been under anesthesia since then, and he's about to go under anesthesia again. Not because I want him to, but because his dental health is so important, and I don't want him to wind up, with some horrible,
Infection.
yes, like
Yeah,
that is what happens in the mouth. It will travel through the rest of the body so fast. That scares me more
for sure.
than the anesthesia does.
For sure.
But again, ask
Yes.
the questions, right?
Yes.
Ask, ask,
Yes.
ask
Yes.
up
Yes. Yes.
front.
Yes. This wasn't meant to scare anybody. This was just
No.
meant to put the onus on you to do your risk evaluation, right? Like your risk mitigation. Put on
Yes.
that put on that really like critical thinking cap and think like what make a list, pros and cons. Like, you know, talk to your vet, talk to trusted friends, talk to other patients of the vet. If you know somebody in your community that also goes to the vet, ask them how their experience has been recently. Just do your due diligence, because
Mm-hmm.
and then trust your gut. If your gut is telling you this is not a good time, something's up with my pet and I don't think he should go under, then trust your gut, because the worst thing that you can do is ignore your gut and then something terrible happens. So I've always been a big believer in trusting your gut. So if there's something that really is weighing on you and you're really like, I don't think that this dog needs this or this cat needs this right now,
Mm-hmm.
let me look for another option. Please consider the other option. And I just did this for my personal health. Like I was supposed to be planning like a surgery that I'll leave the details out, and I was like, you know what? Do I really want to go under anesthesia? Like there's
Right.
still a risk, and I'm a mom and I have
Yeah.
kids, and I don't want anything happening to me. And I also don't want anything happening to me where like even if I come out of anesthesia, the surgery, there was a mistake and something goes
Mm-hmm.
wrong. Because
Yeah.
there's no guarantee that you come out of the anesthesia, the surgery was a success, right? Every medical procedure has a risk. And for that reason, you need obviously informed consent. And informed consent comes from asking all these questions and making sure that there are no other options that kind of delay that surgery if
Mm-hmm.
it needs to be delayed, or give you another option that maybe could make the surgery unnecessary.
Yes.
But dental cleanings, unfortunately, you're gonna have to be very, very active in your pet's dental health
Mm-hmm.
if you wanna delay those dental
Yeah.
cleanings.
Absolutely. Especially our cats. Lord have mercy.
Yes.
Whew. So
Hopefully we didn't scare you too much,
I
Trans Girl
know.
12.
I know
She's
that.
gonna do just fine.
Mhm.
She's gonna do just fine. And
But
if you need any reassurance, please DM
yeah.
us. You're always here, so thank you for joining us. I appreciate you.
I know. And it wasn't like for me, this was not to scare anybody at all. It's just more information. The more information we have, the better decisions that we can make. And if we know, like, there are questions that we can be asking, then we need to ask those questions. And
Yes.
sometimes just the fact that we ask questions puts it, I'm not saying just in the medical profession or veterinary profession, or like literally anywhere, anything you're doing. If you are asking informed questions, it puts people on their toes. Like, oh shit, this person knows what they're talking about. I can't mess this up, right? Like, just ask
I
the
I agree.
questions.
I agree. It's funny. Chris, my husband and I went to a doctor ages ago, and we had such good questions, and he knew that my husband was military, but he was like, are you guys in the medical field? Because we
Yeah.
asked such good questions. And my husband, he didn't know what my husband did, he didn't know what I did. But it was really funny because the more informed you are, the more I think the more elevated a conversation you can have as well. So
Yeah.
that's really good. Also, guys, next week we're going to be talking about a really fun topic that you guys can come and join us for. I don't even know the answer yet. I have to do some research, but it's raw covered kibble. Raw covered kibble is the next week's conversation. If it sounds like an oxymoron, it is. It pretty much is. So we're gonna dig a little deeper into what it means to cover a bit of kibble with raw coating. It's like an M&M,
Freeze
and
dried.
the
Yeah.
candy coating is raw.
Yeah, right? I know. It's so funny you said that oxymoron because I don't think it was last year. I think it was the year before at Super Zoo in the emerging products section. I kept seeing on like multiple products like holistic kibble. And I'm like, this is such an oxymoron. Who is
Yeah.
falling for this? Like, Like
Well,
that's
we
the
all are.
exact
We all
term
are
that
because
I
marketing is my son is 6 years old, and I can tell you marketing works because he comes and
Oh
tells
yeah.
me all these things that he saw on a YouTube commercial, and I'm like,
Yeah.
or on a YouTube video, and I'm like, did you not notice those were cartoons? He's like, oh yeah, yeah. So like we're super susceptible
Yeah.
to like nothing. Yeah, it's
I
a
know.
joke. It definitely is. Raw covered kibble is a
Yeah.
joke, but we're gonna dig into what they're saying and why we're supposed to be into it. So thank
Yeah.
you guys for joining us. We will see you next Monday, and don't forget to watch
Yes.
our shows covered in pet hair
Yes.
and the Pet Parenting Reset. We have new episodes every week, and I would love for you guys to tune in. I'm sure Jessica would as well.
Yeah, absolutely. Thank y'all for being here, and we'll see you next week.
Bye.